Hey folks, Dr. Gerstmar from Aspire Natural Health. Good morning, good afternoon, good evening. Whenever you're listening to this, I hope you're having a great day. Today, let's pick up. We are on step 5 of the 10-step Aspire method. If you're just happening to listen to this podcast now, we've covered the 4 other steps. And what the Aspire method is, it's a method that we've developed after more than 10 years of working with people with digestive issues and autoimmunity and looking at the people who succeeded, who got the results they want, who saw a major improvement in their digestive issues or autoimmunity, their quality of life skyrocketed. In fact, they went on to live that bigger and better life. What was the difference among those people, and what happened to the people who did not get the results they were looking for? And from that, over the years, we kept tinkering and tweaking until we developed the 10 steps of the Aspire method. So in these podcasts, we are going over the 10 steps. Look, if you're looking for significant improvement, you're looking not just for temporary improvement, but long-term and sustainable improvement, you are going to need to work these 10 steps. Now, some people need to work very intensively on certain steps and not much on others, but you need to make sure that all 10 of these steps are covered. All right, so let's talk about step 5. Step 5 is all about balancing inflammation and the immune system. Balancing inflammation and the immune system. Now, many people, probably yourself included, have heard the term inflammation now and have heard that inflammation is bad and inflammation is at the root of many different diseases. So autoimmunity for sure, but also things like heart disease, diabetes, even depression. Again, many digestive issues have inflammation as one of the issues that is going on. So let's take just one moment to talk about what inflammation is, because many people have heard about it, but when I ask them the question, hey, do you actually know what inflammation is? They go, no, it's a boogeyman, right? It's something bad, but I don't really know much about it. So very quickly, inflammation simply means an active immune system. Inflammation means an active immune system. And so inflammation in general is not bad. Inflammation is both good and bad. So if you've ever been on high-dose steroids or for, say, a flare of autoimmunity, then, for example, you know that wounds, cuts, scratches, and wounds heal poorly or not at all. Why? Well, steroids are a big inflammation killer, right? Their job, what steroids like prednisone do, is they disable inflammation in the body, and that means they disable the immune system, and inflammation is necessary for proper wound healing. So without some inflammation at the right time in the right place, wounds, cuts, scratches, and all the rest are not going to heal. Or you may have been on immune suppressing drugs for the treatment of autoimmunity, and maybe that really helped the autoimmunity, but you noticed that you were more vulnerable to getting infections. In fact, one of the things that they have to do before someone can start immune suppressing drugs is screen you or check you for certain infections. For example, if you happen to have tuberculosis, going on an immune suppressing drug can make it way, way worse and can be life-threatening. Why? Because the immune system and inflammation is necessary in order to fight off infections. If we don't have any immune activity and thus any inflammation, we cannot fight off infections. And why many of the immune suppressants have an increased risk of cancer. Why? Well, again, we need a certain amount of immune activity and inflammation to kill off cancer cells that are created in our bodies before they can become problems. And so disabling the immune system, right, disabling inflammation, means our body is less able to fight off those cancer cells and get rid of them before they become a problem. So when we talk about inflammation, many people are like, great, we need to kill inflammation. And no, actually, we don't. Listen, as part of the process, yes, we may need to get inflammation down. In fact, a lot of times people are unable to heal digestive issues simply because they can't or don't get their inflammation under control, and the body cannot heal properly when there's a lot of inflammation going on. So we need to balance out inflammation. Again, we don't want to get rid of it forever, but we want it to be appropriate. We want it the right amount in the right place at the right time so that everything works properly. We don't just want to smash the immune system so that it can't work properly anymore, which means we don't heal as well, which means we're more vulnerable to infections, and which means that we are more vulnerable to getting cancer. None of those things that we want. Instead, we need to balance out the immune system. And so for most people, especially those with autoimmune issues, but often indigestive issues as well, step 5 is a major part of a person's healing. And it's, again, why does this process take a while? Well, again, you can take steroids just to smash inflammation. They have lots of long-term side effects, so you can't or shouldn't stay on them for long periods of time. But if our goal is not just to temporarily manage inflammation, but we need to get to the root causes of why a person has all this inflammation, and we need to deal with those, and we need to manage the immune system properly, that is something that takes time. So for most people, they're seeing improvements fairly quickly. Within 1 to 3 months, often things are feeling better than they were, but it does often take 6, 10, 12 months to get to the root causes of what's going on and treat those effectively so that we are balancing the immune system. And for some people, it's fairly easy and straightforward, and for some people, it is quite a process and involves other steps in the Aspire method as well. All right, folks, so step 5, an absolutely critical one, is balancing inflammation and the immune system. Like Goldilocks and the Three Bears, right? We don't want too hot, too much inflammation. We don't want too cold, not enough inflammation. We want that porridge or that bed or whatever else was in the story. We want it to be just right. We need inflammation if we're going to be healthy and our bodies are going to work properly. We just don't want too much. All right, folks, that is it for step 5. Tomorrow we will pick up on step 6 of the Aspire method. All right, so listen, we have been covering the foundations, the basics, the principles to understand what people need to do to get better. Your next step is to go to the website, www.aspirenaturalhealth.com/book. That's aspirenaturalhealth.com/book, and pick up my best-selling book, The Clear Path to Health. It was written to demystify, to decomplexify, there's a nice big word for you, right? But to make it simple, to understand what are the principles behind health and the principles behind disease. Because just like inflammation, people have heard that word, but don't really know what it is and don't really know what to do about it. Health has become unnecessarily complex. A lot of people want you to believe that there are all these missing pieces. It's so complicated, and the basics really are not complicated. So in the book, I have distilled down tens of thousands of hours of study and education, literally hundreds of thousands of dollars of money spent on education, continuing education, and training, and distill that all down for you in a way that makes it easy to understand, that clears the complexity, and makes it so that you are able to take charge of your health. All you need to do is go to aspirenaturalhealth.com/book and pick it up today. All right, folks, that is it for me today. Until next time, take care.